I have a nephew and a niece that have both had ACL reconstructive surgery by Dr. Shelbourne and both had outstanding results. My son hurt his knee playing basketball this last winter, and we spoke to 3 different practices about the procedures that they would utilize on a 13-year-old boy who's actively growing and wants to have a future in terms of playing basketball and playing sports. And I heard basically the same information from 2 of the 3 until I came to Dr. Shelbourne. And Dr. Shelbourne had facts to back up why his were different. And the first being that he's done 6,000 plus knee surgeries, which speaks volumes, because when you talk to other physicians, they've done a handful, be it teens or 20s or 30s of them. And especially on a 13-year-old boy was the biggest thing, the reason that we said we wanted to talk to Dr. Shelbourne. And not only was it the parents deciding, it was my son feeling very comfortable with the course of treatment that we were going to undergo with him. Dr. Shelbourne is more than just a physician. He truly cares about his patients, as do the staff that have been working with us. And it's a difficult procedure to go through, considering physical therapy begins very quickly with this procedure, and it is very painful for the patient. But in terms of it, there's history and there's reason for them to do it, and the outcome is exceptional. Dr. Shelbourne's confidence in terms of what he's doing, because the internet is a good thing and a bad thing, so I did a lot of research, and a lot of the research backed up what the other physicians were saying, and he was able to contradict those with facts. And with the studies that he has undergoing currently, as well as the studies he's had in the past, it was indisputable that this is the type of procedure you need to utilize. This is the follow-up care you need to be able to be very not only cognizant, but just very bought into. And the outcomes can't be beat. Simple as that. The outcome of 1 month out is almost 0 swelling, complete range of motion, complete activity for Riley too. I think the biggest thing, we were just talking about this, we have a friend whose daughter has a knee injury, and she's going to one of the groups that we talked to earlier, and she's being braced prior to it, which limits movement. And one of Dr. Shelbourne's keys is he wants complete range of motion and as much strength in the knee, the joint, as possible. And Riley was able to have that. Completely different than I'm used to seeing. I should also say, here's a little history. Riley, unfortunately, injured his shoulder playing football this last year too. So he had a shoulder surgery in June, so 6 weeks prior to the knee surgery. And typical procedure was an open wound. The use of opioids, he had to take Vicodin at a regular basis just to deal with the pain. And I just thought that was normal. And the thing with Dr. Shelbourne is the pain control that we've gone through with this blew my mind. There was 0 opioids utilized, even with the therapy that was brought on. The icing and the movement and the non-steroidals that you utilize, it's unbelievable. It's the best pain control I've seen, and I've worked in pain management for 15 years. So. I already have, and it's very interesting too, because living here in Indianapolis, someone you talk to is either personally had experience with Dr. Shelbourne, or they have a family or friend that's talked to Dr. Shelbourne, and for everyone you speak to, it's a good outcome. And again, you don't expect to hear that from every physician. Physicians usually, have some issues, which it happens. But I think with the amount of research and the amount of protocol that they have you follow it, and the results speak for themselves.